Everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about some considerations and things to think about when it comes to anesthesia and your knee replacement surgery. Everyone, so today we're talking about anesthesia and its relation to knee replacement surgery and some things to think about and considerations and just a general overview. Now, the one main thing with anesthesia is the different types of anesthesia that you can receive with your knee replacement surgery. And we did an episode on this before, so I'll leave a link in the comments in the description below that you can go and check out that video. But just a brief overview, there's options of general anesthesia, so anesthesia basically putting you out, going to sleep, sedating your whole body. There's local anesthesia, so for example a spinal or an epidural, which is going to numb basically your whole lower body. And then there's also local anesthetics such as a femoral nerve block that you may receive as part of your pain management with knee replacement surgery. And each one has some positives and some drawbacks, and we go a little bit more in depth with those in that episode. So be sure to check that out if you're interested. In this episode, we just want to talk about some different things that are out there. So people sometimes get very worked up and very nervous about using anesthesia, using this for their surgery and going under, and potential risks and potential horror stories that they might have heard. So probably the most common horror stories are dying while you're in surgery, or being paralyzed under surgery, or the other side of the coin is waking up during your surgery and not having that numbness and feeling everything that's going on. And just to reassure you all, this is extremely, extremely, extremely rare. Death, paralysis, things of that nature are very, very rare. We're talking about in fractions of a fraction of a percentage chance of that happening. There's so many surgeries, so many orthopedic surgeries, so many knee replacement surgeries that go on throughout the country, throughout the world every day. And the risk of that happening is so extremely rare with the number of surgical techniques and surgical strategies and risk mitigation strategies that are out there. This is extremely rare. Of course, you hear about when it does happen because it makes for a good story, or a bad story, I guess, but something that people will watch and people will listen to and look at. But really, it's just a horror story. It's something that's blown a little bit out of proportion. So please, if that helps at all, these things occurring, although possible, are extremely, extremely rare. Now, when it comes to waking up during surgery, when it comes to feeling the pain of the surgery, this can happen as well. But what it is it's kind of a misunderstanding. Sometimes what can happen is an individual might not get a high enough dose of anesthesia, or they might have a lower dose, and this might be because you have certain risk factors, certain things where they don't want to give you a very, very high dose, and they might give you a lower dose of anesthesia, and it's going to be enough to really put you out and really don't remember anything. But there's always that chance where you have this very vague understanding of the surgery and knowing what's going on. And again, this is very low risk, but when it does occur, it's not like you're fully awake and fully experiencing everything. It might just be where you have that vague fogginess, that vague recollection of a little bit of what happened during surgery, just because that dose of anesthesia might be a little bit lower. But again, this is very low risk and managed very effectively in the vast majority of cases. Now, some things to think about is, it's not all perfect. There are some risks of things going on. So some things that put you at risk when you do have anesthesia, when you do go under for surgery. If you have a history of seizures, if you have a history of alcohol or drug abuse, if you have a history of bad reactions to anesthesia, if you smoke, if you have high blood pressure or very low blood pressure. If you're taking certain medications, can play a risk as well. And that's one of the reasons why your surgeon and your surgical team are going to instruct you about what medications to wean off of and not take for a certain period leading up to your surgery to help decrease this risk. And there also are some risks involved with having allergies, with having diabetes, or being overly overweight or obese. So yes, these risks do occur, and there are these risk factors that do increase your risk for things, but again, at the same time, there's lots of strategies and ways to manage and mitigate these risks that make the risk of something very significant complication, such as the paralysis, such as death, such as waking up, being very, very uncommon, very, very low likelihood. There are a couple things that might happen as well with anesthesia after surgery. So, for example, you might have things like trouble urinating if you have a general anesthetic. You might have some headaches, drowsiness, nausea, feeling of fatigue. You might have some allergic reactions, and there is that low risk as well of potential nerve damage, potential infection from the anesthetic procedure. But again, these are a little bit higher risk than the very severe things, but again, very, very low risk due to good surgical procedures and management strategies. So if you are someone who is worried or concerned or anxious about going under, about having anesthesia, talk to your surgeon, talk to your anesthesiologist, talk to your surgical team, and talk about the risk factors, talk about your personal factors, your comorbidities, any diseases or things that you're dealing with and managing, and discuss with them what the best options are for you in terms of anesthesia, and that will help to address your concerns, make you feel better that there's an effective plan that is taking into consideration your individual risks and things going on. So anesthesia has been used for a very long time, is used very frequently, very often. Relatively low risks. The risks do exist, but there's definitely ways to help manage those and mitigate those risks so that you can be confident that there's a very, very, very low chance of having any negative outcomes from going under during your knee replacement surgery. Thank you very much for watching, everyone. As always, post your questions, post your comments, your feedback. I'd love to hear it. As always, please subscribe on YouTube so you can catch all of our videos, and have a great rest of your day.